Whenever the conversation turns to the pressures on the NHS, there's this one question that always comes up. It feels so simple, so obvious that you really have to wonder, why are we still talking about it after all these years? Right? This is it. This is the starting line for pretty much every single chat about the NHS workforce. And you know what? It's not a bad place to start. It feels like the answer is baked right into the question. But that's the thing, isn't it? If the answer is really that simple, why does the problem just seem to get worse? Well, that's what we're going to dig into. We're going to pull on that one seemingly simple thread and see just how deep this thing really goes. Okay, first things first, let's bust a big myth right out of the gate. This crisis we're feeling in the NHS, it didn't just pop up overnight. Not even close. The writing was on the wall for decades. And here's the thing, none of this should have been a surprise to anyone. We knew the population was getting older. We knew more people were living longer with chronic conditions. We knew new treatments were coming online. This was all there, clear as day in the data. The demand for doctors was always going to go up. This wasn't some sudden storm. It was a tide that everyone saw coming in. So, and this is absolutely crucial, the problem was never a lack of foresight. It was a failure to act on that foresight. And why? Well, because training a doctor from their first day at med school to becoming a fully qualified specialist or GP, that takes 10 to 15 years. Think about that. That time frame stretches way beyond a single government's term or a single short-term spending plan. Which leads us to the absolute heart of the problem. If everyone could see this coming, who was supposed to be in the driver's seat? Who was supposed to hit the big button that says, hey, let's train more doctors? And this might be the most important thing to understand. We all kind of assume there's some central office, some single person or body with a dial they can turn up or down for doctor numbers. But that person, that office, it just doesn't exist. The responsibility is completely fractured. So here's how it actually works, or doesn't work. The Treasury decides the overall budget. The Department of Health then has to decide how much of that pie goes to training. Then NHS England is in charge of funding the actual jobs for doctors in training. And the universities? They can only offer the number of places they're given the money for. So for years, you had all these professional bodies shouting from the rooftops saying, we're falling behind. But their warnings just got lost in the cracks between all these different organizations. So with no long-term plan in place, how on earth did the NHS keep the lights on? Well, you pull the quickest, most obvious lever you have. You recruit doctors from overseas. Now, these doctors have been absolutely essential. But this total reliance on a quick fix has had a massive, and I mean massive, economic side effect that almost no one talks about. Just take a look at this. Right now, around 40% of the doctors licensed to practice here in the UK got their training somewhere else. To put that into perspective for you, that is about double what you'd see in other similar wealthy countries. We are uniquely dependent on a global workforce. Okay, so let's do a little back-of-the-envelope math. And I want to be really, really cautious here. Obviously, not every doctor who comes from abroad plans to leave. But let's say, conservatively, that maybe half of them are what we'd call mobile. They might be sending money home to family, or they're saving up with the goal of eventually moving on. We're talking about a group of around 65,000 people. And their economic behavior, quite rationally, is just different. Let me be clear, neither of these is right or wrong. It's just what people do. If you're planning to stay, you put down roots, you buy a house, you invest, you spend your money at local businesses. But if you think you might go home one day, you're more likely to send money back to your family or save it, instead of pumping it into the local UK economy. So what does that actually add up to? Well, if that group of 65,000 doctors sends home or saves just 10% of their pay, that's about £240 million leaving the UK economy every year. If that number is closer to 30%, we're suddenly looking at over £700 million. That's money that isn't being spent in local shops, cafes, or on local services. But wait, it doesn't even stop there. See, money that's spent locally gets spent again. The cafe owner pays their suppliers, who then pay their staff, and so on. Economists call this the multiplier effect. When you factor that in, the total lost economic activity is somewhere between 300 million and a jaw-dropping 1.2 billion pounds every single year. That is the hidden price tag for not having a plan. All right, so what on earth do we do about it? Well, as it turns out, there are really two different ways we can go from here. One path is just about stabilizing the system, basically just stopping the problem from getting any worse. The other patch is about actually repairing the decades of damage. So you've got two options.
The stabilizing plan means we train about 4 to 5,000 extra UK doctors a year. That's just to keep pace with new demand. The repair plan, though, is much more ambitious. It says we need to train 6 to 8,000 more doctors, not just for new demand, but to finally start closing that deficit we've built up. The first plan is cheaper, sure, but it means we are basically agreeing to live with this exact same fragile system forever.
And let's be crystal clear on this point. The problem has never, ever been a lack of brilliant young people who want to be doctors. Medicine is one of the most oversubscribed courses in the UK. Thousands of A-star students are turned away every single year. The bottleneck isn't talent or motivation. It's a deliberate, decades-long policy choice to put a cap on training places. You'll also hear people say, well, we don't have enough senior doctors to supervise the trainees. But you see, that's a problem we created ourselves. It's a feedback loop. By investing in more training now, you create a virtuous cycle. More trainees today means more senior consultants and GPs tomorrow, which means you have more people to supervise the next generation. We've just been stuck in the vicious, downward version of that cycle for too long. Okay, let's get to the bottom line. Let's talk money. What would that full repair plan, the one that actually fixes the problem for good, really cost? The numbers sound massive, but let's break it down into something that makes sense. So once everything is scaled up and running, the ongoing annual investment to train enough doctors to finally fix this mess is somewhere between 1.5 and 2.25 billion pounds a year. I know that sounds like a crazy amount of money, but what does a number that big actually mean for you and me? Well, when you spread it out across every household in the country, that huge, scary number suddenly becomes about £6 a month. That's it, roughly the price of a couple of coffees per household per month. That's the cost of a real plan that builds a resilient health service for the future, one that keeps more economic value right here in our own communities. It stops being a bill and starts looking a lot more like an investment. And really, that's the final thought to leave you with. This doctor shortage isn't free. We are already paying for it. That 1.2 billion pounds in lost economic activity proves it. So the choice isn't whether we pay, it's how we pay. We can keep paying the hidden, chaotic, and inefficient price of a constant crisis, or we can choose to invest in a real, permanent solution.